Hi, my name is Robert Miller. I'm the CEO and co-founder of Honeycomb Health. So I've been talking anyone's ear off that will listen to me about blockchain and healthcare and the intersection with cryptocurrencies since I found Bitcoin in 2011 on Reddit. Professionally, I've been working in blockchain and healthcare when I joined Medical Chain, a decentralized electronic health record. But since then, I've started my own company called Honeycomb Health. We use blockchain as a way to manage access to patients' data, and we create disease-specific information management tools for patients with rare diseases to better manage their health. I wrote about healthcare ICOs, or initial coin offerings. This is a new type of fundraising where projects will crowdfund their development. I wrote about this because it is integral to understanding the blockchain and cryptocurrency space. But no one had looked at the intersection of healthcare and ICOs to see what the landscape looks like, what the trends are, what the returns on these investments have been to date, what the best practices are. And despite there being a tremendous amount of activity, 150 plus healthcare ICOs and $500 million invested in the past 2 years, there was really no place where I could go and read an overview. And I thought that was important to disseminate that information. Within healthcare ICOs, there are a lot of issues we haven't figured out. We know how to value a share of a company. We know how to value a bond. Those are, or derivative if you want to get a little bit more esoteric. These are complex things, but they've been figured out and there are equations for that. We have no idea how to value a cryptocurrency, and that has led to a lot of speculation within ICOs and a lot of bad return on investments. There are multiple reasons for that, and this is not necessarily anyone's fault, but we need to have a better sense of how to create long-term sustainable cryptoeconomic systems, because those can be really powerful tools for achieving some sort of desirable social outcome. It's just to date, no one has cracked the code as to how to properly design an ICO to achieve that social outcome that's desirable. I'm really excited because there's been a tremendous amount of money, a tremendous amount of interest, a lot of talent pouring into the space, and I feel like we're at this critical junction point right before a lot of things actually start hitting production, and where some of the hardest problems in the blockchain space, not necessarily specific to healthcare, but just overall, are getting tackled, and there are some solutions coming out. In particular, I'm talking about user experience problems, of abstracting away the complexity of things like public-private key cryptography, better wallets coming out. And I'm excited to have some examples to point to of implementations of blockchain in healthcare, where I can say, this is something that is live in production, and here are the outcomes and the statistics that this implementation drove. What I would say is that blockchain is a fundamental technological revolution, and that means that in these early days we may not have necessarily figured out the best use cases for it yet. There are, like any disruptive technology, it will enable things that were not possible in previous paradigms. Like the internet enabled new business models, there are completely new business models enabled by blockchain technology that after 10 years of blockchain being introduced to the world by Satoshi Nakamoto, we still haven't figured out. So I would say that readers of this book should keep that in mind, that this is a very new, a fundamental technological revolution, and to spend time thinking about what blockchain can enable that was not possible before, because I think that is where the real fundamental value will be created on a long-term scale.